Pitations is a 60-year-old accountant that comes to see you because of an episode of chest pain. While running earlier that day, he felt the sudden pain on his chest, bad enough that he had to stop exercising. He says this has been going on for about 4 months now, and that the pain comes and goes. It feels more like a crushing sensation, as if someone is sitting on his chest, but it tends to go away with rest. He reports no fever or coughing, but he does experience some breathlessness when the pain comes, and notice that he has been getting tired more easily, like when walking up a set of stairs. You ask if the pain spreads anywhere, and Paul says he thinks he felt it a bit on his left arm, but is not too sure. When asked for his ideas, Paul puts it down to being out of shape, as he does not get much exercise and tends to eat a lot of fast food. However, Paul is concerned that there could be something wrong with his heart, as his dad died of a heart attack at 60 years of age, the same age as Paul is right now. Paul expects to know what is going on with him and wants some sort of pain relief for when the pain comes again. When asked about his past medical history, Paul reports having hypercholesterolaemia, but nothing else significant. He also has no allergies, and as of medications, he's taking atorvastatin for his cholesterol. However, he says he's not very good at taking his meds appropriately. Paul is an avid smoker and has been smoking for over 30 years, around a pack of cigarettes a day. He's an occasional drinker, drinking about a pint of beer a week. Based on this brief history, what do you think is the most likely diagnosis for Paul? Leave your comments down below before we review the answer and break down this case. This is a case of stable angina. If you don't know what angina is, I've made a video on it a couple months ago, so you can check that out. But for now, I'll just give a brief explanation of what stable angina is, and then we will break down this case and see why is it that Paul is most likely suffering from angina. Stable angina is a condition where you have atherosclerosis inside the coronary vessels. So the coronary arteries are the arteries that supply blood to the heart muscle. And as we will see here in the video, once we have the buildup of that fatty plaque inside the coronary artery, there will be a decreased blood flow to the heart muscle. And so when a patient, for example, is exercising and there is an increased demand for oxygen by the heart muscle, that decreased flow will not be able to meet the oxygen demand, and so you get the chest pain. Now, angina often leads to a heart attack if it is left untreated, because that atherosclerosis that plaque can grow, it can rupture, leading to the formation of a thrombus or a blood clot that will unfortunately block all the blood flow to the heart muscle, leading to cardiac cell death, which is a heart attack. So angina, there is diminished blood flow to the heart, and then in heart attack, there is no blood flow to the heart muscle. Alright, so the first information we get from our patient is that his name is Paul Pitations, he is 60 years old, and he's presenting with chest pain. Now, as you can see, there are a bunch of conditions that lead to chest pain, and we need to figure out which one Paul has, or what's going on with him. And obviously, in a clinical scenario, you won't figure it out just by talking to the patient. There are often tests and examinations that need to be done, which will all help us reach a diagnosis. However, when you're interviewing a patient during a consultation, you need to have an idea of what's going on so that you know what tests to order, what examinations to perform, and just have an idea of what's going on with the patient. And that's what we're practicing here today. So in this case, it is most likely angina, and here's why. Paul has told us that while running earlier that day, he felt the sudden pain on his chest. So here we have the onset. It was sudden. So it didn't develop over a few hours or days. And that makes us think it is probably something like angina or a heart attack, could be pulmonary embolism, and a number of other conditions that have a sudden onset. But then we can start thinking it's probably not something like a pneumonia, for example, as pneumonias tend to develop over the course of a few days. You start feeling poorly and you slowly progress to feeling even worse. Now, this next bit of information, he says this has been going on for about 4 months now, and that the pain comes and goes. So this is a really important one as well, because conditions like a heart attack or pulmonary embolism or pericarditis, whatever, many of these conditions don't just come and go. For example, a heart attack, if you're having a heart attack, you're going to have to go to the hospital. There's going to have some intervention so that you feel better. And it won't just go away if you just don't do anything about it. But like we described angina, since there is just a decreased blood flow to the heart muscle, if you stop exercising, that tends to get better. And the next statement there confirms this. So he says it feels more like a crushing sensation and goes away with rest. So that goes away with rest is very characteristic of stable angina. Also, he says it feels more like a crushing sensation, and he did mention as if someone is sitting on you. And that is a classic way that patients will describe heart attacks or even angina sometimes. So it is more characteristic of some coronary artery disease, which is that atherosclerosis in the coronary vessels. Moving on to these next points, he reports no fever or coughing, but he does experience some breathlessness and has been getting tired more easily. So a fever is our body's natural response to an infection. It tries to raise our body temperature to help us fight the germs. So if there's no fever, that is a sign that there is no serious infection. So a pneumonia in this case, for example, is unlikely, especially with no coughing. Also, lung cancer, which could be a cause of chest pain, also presents with a lot of coughing. It tends to. So that is looking also a little bit unlikely. Now, breathlessness is a big one. So chest pain with breathlessness could be a pulmonary embolism, but how we described before, that's also not likely due to improving with rest. And then getting tired more easily is also a characteristic of angina or heart disease, and that breathlessness as well. So patients with angina or heart attack can also present with breathlessness and short of breath, getting tired more easily. So next, he does not get much exercise and tends to eat a lot of fast food. So that just shows some unhealthy lifestyle choices, and those two things increase your chances of cardiovascular diseases, in particular atherosclerosis, which is what we think is going on in this patient's heart. And the next one is a big one. So his dad died of a heart attack at 60 years of age. So a positive family history is a big contributor to your risk of developing heart disease. And 60 years of age is young for someone to die from a heart attack or have a heart attack. So that means that Paul has big chances of developing heart disease as well. Now, Paul also has hypercholesterolaemia, which just means a lot of cholesterol in your blood. And that fatty plaque that builds up inside of your arteries when you have atherosclerosis is primarily made up of cholesterol. So if you have a lot of cholesterol in your blood, you're likely to develop atherosclerosis. And next refers to atorvastatin, which is a cholesterol-lowering medication. And Paul is taking that medication. However, he says that he's not so good at taking it appropriately, meaning that doesn't necessarily mean that his cholesterol levels are controlled, even though he is prescribed atorvastatin. And then lastly, he has been smoking for over 30 years, and smoking is also a big contributor in those risk factors for atherosclerosis and heart disease in general. So we can conclude that Paul most likely has angina due to all of those things that I showed, and also all of those risk factors for heart disease. As we are at the end of the video, I'd just like to say that Paul is a fictional character and these are not real patient information here. It's just for us to practice. And this case was based off a website called Medisense, where you can find hundreds of cases just like this. In fact, much better than this, to be honest. But yeah, I'll have a link in the description for the website. You should definitely check it out, help you learn a little bit more. And obviously, this is not sponsored. I just genuinely like their website. So yeah, I hope you guys enjoyed. And if you're a student of any kind, don't need to be in the health section. There is a Discord in the description for students to help each other motivate to study and so on. So if that seems like a good idea, go check it out below. And I hope you guys enjoyed. If you did, don't forget to leave a like and subscribe for more.